Okay. All right, so we are now here with Cheryl Farley. Cheryl is a registered nurse who works for United Hospital Center in the cardiac rehab department. And she's going to share some information about what she does and how her department works with patients in Harrison County and beyond. How are you today, Cheryl?
I'm great. It's good to be here.
Good to have you. Can you tell me a little bit about what is cardiac and pulmonary rehab and who can benefit from these services?
Well, cardiac rehab is a program designed for heart patients, and insurance and Medicare have regulations as to who qualifies to enter cardiac rehab. So if you have the correct diagnosis, then that's your ticket punch into cardiac rehab. So it's benefiting patients that have bypass surgery, stents, a heart attack, heart transplant, angina, or heart failure. Those are the covered diagnoses. And pulmonary rehab is to benefit patients with chronic lung disease, typically COPD, but it's also open to a variety of lung problems: pulmonary hypertension, pulmonary fibrosis, restrictive lung diseases, asthma, emphysema, chronic bronchitis, those type of diagnoses. Again, with some of the diagnoses, Medicare has regulations and you have to meet certain criteria, and your pulmonary function test has to have certain numbers or they won't pay for pulmonary rehab. So the programs are both designed to be 12 weeks long, and patients come in 2 or 3 days a week to exercise with us. So they get in shape, but it's not just about physical conditioning. We also provide education to them. So we want them to learn about their heart disease or their lung disease so that they're able to care for themselves for the rest of their life. 12 weeks here with us getting into shape physically doesn't mean anything if they go home and don't know all the basics of taking care of themselves and what they need to do to continue a healthy lifestyle.
Sounds like a great program, and it sounds like a wide variety of patients can benefit from that program. You touched a little bit about insurance coverage. Can you tell me a little bit more about insurance coverage, and what about patients that are uninsured or underinsured? What options do they have?
Well, insurance coverage, we have Medicare. A lot of our patients are Medicare age, and Medicare has very strict guidelines for cardiac rehab on diagnosis. The good thing about cardiac rehab and Medicare coverage, or basic insurance too, is that every new event allows you to come to cardiac rehab. So if you have a heart attack, you can come to cardiac rehab, and later you have a stent put in, you can come to cardiac rehab. If you have bypass surgery 5 years later, you can come back to cardiac rehab. Pulmonary rehab, they have very restrictive diagnosis as well as parameters that you have to have certain testing and then meet numbers for that. Most of the insurances cover 80% or more. Medicare covers 80%, and then the supplements, if you have a supplement, will cover that. For people that don't have insurance, the hospital has a charity program that you can apply to have charity care, and they will take care of the entire bill for you. Once you apply for that, if you're approved for that status, then it covers any care that you have at United Hospital Center. Also, if you have Medicaid, we work with the Medicaid system. We also work with private insurances and Medicare.
So it sounds like a lot of insurances can potentially be covered, not just Medicare. Patients just have to be willing to start those conversations.
Yes, and we have to have a physician's order for you to start cardiac rehab. So once we have the physician's order, then we contact you to see if you're interested in cardiac rehab. We get the insurance information, and then we call to see if there's any pre-authorization that needs to be completed. If that needs to be completed, we take care of that. And then we usually find out what the exact amount you will pay, so that when we call to schedule the patient, we're able to tell them exactly what the program will cost them.
Okay, great. That sounds great. I know that cardiac rehab has different phases. Can you tell us a little bit about those phases?
Sure. Cardiac rehab, we have 3 phases. Phase 1 is inpatient. So someone that's in the hospital that just had a heart attack or had a stent put in, we go upstairs and see the patient and do education, and sometimes get them up and walk them around the hallway just to document what their heart rate and blood pressure are doing before they go home. It really feels good sometimes to be up and walking with a nurse with you rather than going home and being afraid of what you can and can't do. So we do a lot of education about what medicines they'll be going home on, any activity restrictions they have when they go home. Phase 2 is our early outpatient. It's typically a 12-week program, and the cardiac patients wear a heart monitor during that time, and we get blood pressure at rest with exercise and at cool down. The pulmonary program, they don't wear a heart monitor, but they're wearing an oxygen monitor. So we're monitoring their oxygen levels during their entire session, and again, get blood pressures at rest during exercise and cool down. And then with all that exercise is education also. So each week we provide a different topic of education and lots of handouts for people to take home and review when they get home. And then we have a maintenance or phase 3 program that is open for them, that they can continue their exercise program with us, but it's not monitored. So the heart patients are no longer wearing a heart monitor, but they're supervised by a nurse or an exercise physiologist. And we do monthly checks with them, checking their heart rate, heart rhythm, and blood pressures. We also are there if they come in and aren't feeling well to assess them and get them where they need to be, if they need to see their primary care doctor or if they need to go to their cardiologist. We also have a maintenance for pulmonary rehab, but we have not resumed pulmonary rehab since COVID started back in March.
I've had the opportunity to observe your Step 3 program, and one of the things that struck me about it was not just the physical activity and the extra added sense of security that they have with a nurse present, but also they were kind of a support system to each other in that program too.
They truly are. These patients come in, and we have patients. I've been in my position here almost 29 years, and we have patients that have been coming here over 20 years. And they come in and exercise with us, and they have an assigned time to come in. So we have different class times, and they're the same people coming in 3 days a week or 2 days a week to exercise together. And they're family. They truly develop a great relationship, and they are more supportive to each other than we could ever be to them. We provide a lot of support for them, but it's nice to know the person right next to you has had a similar problem to you, and you can talk about it freely with them. So it really is a very neat dynamic group.
Yeah, I thought so when I got to see it. So um, let's see. Do you have any stories that have stood out to you over your time at UHC with cardiac rehab?
Well, we see it's a delight to see people get better. And we're so blessed in the fact that when we see patients when they come in and they're really at a low point, they've just had open heart surgery, or they've had a heart attack and stents, and they're scared to death. And we have patients that start the program, they come in a wheelchair with a family member pushing them because they're unable to walk down the hallway to get to our department. And you see this glimmer after the first couple of weeks, and they're actually starting to feel better. And then a couple of weeks later, they're feeling even better, and they get rid of the wheelchair and they're walking from the parking lot into the building. And by the time they finish the program in about 3 months, they are so much better and they feel so much better. It is just so heartwarming to see how much better they can be doing. These people not only are better than they were when they had their heart problem, some of them are better than they were for the last 20 years. So they may not just feel better than they did prior to bypass surgery or prior to their heart attack, but they're feeling better than they have for a very long time. We've had heart transplant patients, and to see the transplant patients do so well. We have patients that have been with us over 15 years and are 15 years out for their heart transplant and are doing amazing. So we are very lucky. We have rewarding jobs. We get to come to work and see people get better, and we get to have a relationship with them. I don't go to the grocery store very often that I don't run into somebody that's been through cardiac rehab. My husband teases me all the time about, well, we can't go anywhere where you don't run into somebody. So it's been a fun job.
That sounds amazing and very rewarding for both you and the patients. Now, you touched on this last question a little bit.
Sorry, my light went out.
Oh. Technology.
If there's no movement for 10 minutes, the light goes out.
So you touched on this last question a little bit earlier, but I don't know if you had anything to add to it. How has the pandemic affected your ability to provide services?
Well, we closed the department in mid-March, and we were closed for 7 weeks. We didn't see any patients for 7 weeks. We kept in touch with everybody that was already enrolled in the program. We called them at least once a week and documented that we talked to them and how they were doing. And most of them truly appreciated that contact. When we reopened, most of them did return, and then we started the program back up from scratch, because not everybody returned, but we had quite a few. We started the cardiacs back, and they've done very well. We do an extraordinary amount of cleaning. So the department is as clean as it can possibly be, and people wear their mask. So it's difficult exercising with a mask on. And some people struggle with that. We try to get them to wear as thin a mask as possible. Our class size is also limited now. So we used to allow, in our phase 3 program, we could have 15 patients in a class, and now we're down to 9. In our phase 2 program, we had 11 or 12 patients in a class, and now we're down to 7. And that is so that we can adequately space out and not have more than 10 people in the room. Trying to comply with all the regulations. So when everybody's exercising, you're 6 feet apart now, and you're wearing a mask, and it is difficult. We are hoping to open our pulmonary rehab program again later this month. But I'm really concerned about how difficult it's going to be for pulmonary patients to wear masks while they're exercising. It's already difficult for them to breathe, but putting a mask on may make that even more difficult. I don't think we can loosen that restriction, though, just to keep everybody safe, staff and patients. We require masks, so that I don't see that changing anytime soon.
Yeah, COVID has definitely made all aspects of life more difficult, and especially healthcare. So
Yeah. It's been a crazy ride to get through all this, but we are still in business, and we're trying to help as many people as we can. And there are people that are afraid to come, and there are people that are nervous, and they relax after they get here and they see how clean we have everything and how safe it is. But it is stressful.
well, Cheryl, thank you so much for your time today. We so much appreciate
You're very welcome.
with us.